Hey everyone, welcome back for another deep dive.
Oh, it's great to be back.
It's always fun to dig into a new topic, and today we're tackling the brain.
Yeah, the brain and mental health.
Which, as you know, for future nurses and nursing faculty, this is a huge
Absolutely.
topic and a big one that we're going to see.
Yeah, you're going to be dealing with these concepts throughout your whole career.
For sure, throughout your whole career. And we've got some excerpts today from a well-known physical examination textbook.
Okay.
And so we're going to be kind of pulling out the
need-to-know
information from those sources today to give you a head start in understanding this fascinating field.
Yeah, it's a constantly evolving field.
Right.
And as nurses, you are going to be right on the front lines of patient care.
Okay, so let's get this brain party started.
Right.
This textbook emphasizes how the brain's organization is way more intricate than something like the heart or the stomach. It's not just one big lump, right? We're talking specialized lobes, subcortical structures.
Yeah.
It's like a city.
It's like a bustling city with all kinds of neighborhoods.
With very specific neighborhoods.
Very specialized neighborhoods.
Yeah.
Yeah, and it's fascinating how interconnected these areas are.
Okay.
It's not like one spot controls happiness and another memory.
Right.
It's a network which makes understanding the causes of mental disorders super challenging, but also super interesting.
Yeah, that interconnectedness idea really stuck with me.
Yeah.
That it's like a domino effect.
Yeah.
Well,
But it can impact each other in ways that we're still unraveling.
Right, and we're still unraveling them, right?
Yeah.
So how does that network idea affect how nurses approach patient care?
Well, that means that we have to consider the whole picture,
Now-
not just isolated symptoms.
Oh, okay.
So, for example, if a patient is experiencing fatigue,
Right.
it could be linked to a physical condition, but it could also be a sign of an underlying mood disorder. So as nurses, you're in this unique position to observe these connections and advocate for your patient's holistic well-being.
That makes so much sense.
Yes.
Okay, so let's zoom in on a few specific brain areas that this textbook highlights. One that jumped out at me is the parietal lobe.
Okay.
It's involved in spatial awareness, and the book mentioned how some patients have trouble with this after a stroke.
Right.
I could definitely see why that would be important for nurses to know.
Right. Absolutely, especially when you're helping patients navigate their environment
Right.
and ensuring their safety. But it's not just stroke patients. The parietal lobe is implicated in other conditions like ADHD,
Okay.
which you'll encounter throughout your careers.
Wow, so many connections.
Yeah.
Okay, what about the hippocampus?
Okay.
The textbook describes it as the brain's librarian,
Yes.
the keeper of memories.
And you might imagine when the hippocampus is damaged, memory is significantly affected. That's why Alzheimer's disease, where the hippocampus is often one of the first areas to show damage presence with such profound memory loss.
Right.
As nurses, understanding this can help you provide compassionate and individualized care for these patients.
Absolutely, because those patients and their families need so much support.
Absolutely.
Okay, last brain stop on this tour.
Okay.
The amygdala. Ever felt that sudden rush of adrenaline when you're startled?
Uh-huh.
That's your amygdala, the brain's alarm system kicking in.
Right. Picture if that alarm system was constantly on high alert.
Oh.
That's what can happen in conditions like PTSD.
Oh, wow.
Everyday sounds or sights can trigger an intense fear response. It's crucial for nurses to recognize this and create a safe and supportive environment for their patients.
Wow. That makes those fight or flight responses we learn about so much more real.
Yeah.
This textbook also delves into the world of neurotransmitters.
Oh, okay.
It explains how they're basically the brain's communication network, like tiny little messengers zipping around.
Yes, and when those messengers aren't functioning properly, it can lead to a whole range of problems.
Oh, no.
The book specifically mentions low levels of serotonin, norepinephrine, and dopamine as being implicated in depression.
So it's like those neurotransmitters are the internet of the brain, and when the Wi-Fi is down,
I like that analogy.
everything gets wonky.
Yeah, and that's where medications come in. They can help to rebalance those neurotransmitters. But, as this textbook emphasizes, it's not a one-size-fits-all solution.
Right.
Each patient is unique, and finding the right medication and dosage can be a process.
That makes me think about how important patient education is in nursing.
Absolutely.
We need to help patients understand these complexities and empower them to be active participants in their care.
Absolutely. Now, the textbook also points out that these neurotransmitters don't work in isolation. They're constantly interacting, and that's what makes things so fascinating.
Right.
For instance, low serotonin often leads to a depressed mood. But if you combine that with high norepinephrine, you're often looking at an anxiety picture.
It's like a recipe.
Yeah,
Different combinations of ingredients lead to different outcomes.
exactly.
And as nurses, we need to be able to recognize those subtle variations in how these conditions present themselves.
Exactly. And it's also important to remember that patients often experience both anxiety and depression.
Okay.
So again, that holistic approach to care is essential.
Okay, all this talk about brain chemistry is giving me a mental workout.
Yeah.
But seriously, I think it highlights how important ongoing education is for nurses.
Yes.
The brain is so complex, and there's always more to learn.
Couldn't agree more. The more we understand the brain, the better equipped we'll be to provide compassionate and effective care for our patients. And that's what it's all about, right?
Absolutely.
Yeah. It really is all about that, isn't it? Just caring for those patients. And this textbook really emphasizes that a huge percentage of mental health disorders
Oh, really?
go undetected
Yeah.
in primary care settings.
I hadn't thought about that.
It's true. And as nurses, you're often the first point of contact for patients. So you're in a prime position to notice those early warning signs
Right.
and advocate for further evaluation if needed.
That puts a lot of responsibility on nurses' shoulders.
It does.
But it's also an incredible opportunity to make a real difference in people's lives.
Absolutely. And it's not always easy. Patients might not even realize they're struggling with a mental health issue. They might come in focused on physical symptoms like fatigue or headaches without connecting those to underlying mood disorders.
So it's like those physical symptoms are the tip of the iceberg,
Yeah.
and we need to be looking beneath the surface for what might be going on emotionally.
Precisely. And that's where your observational skills and ability to ask the right questions become so important.
Okay.
The book highlights the importance of picking up on subtle cues, changes in behavior difficulties, sticking to medication regimens, withdrawal from usual activities. These can all be red flags.
It's like being a detective putting together the pieces of the puzzle.
Yes, and remember, having these conversations with patients requires a lot of sensitivity and empathy.
Right.
They might be hesitant to open up about mental health concerns, especially given the stigma that still exists.
That makes me think about how this textbook talks about stigma as a major barrier to people seeking help.
Right.
It's like this invisible wall that keeps people from getting the care they need.
Yeah.
How can nurses help break down those walls?
Well, it starts with us.
Okay.
We need to examine our own biases and make sure we're approaching our patients with compassion and understanding. And the language we use matters too. The textbook emphasizes the importance of person-first language, like saying a person with schizophrenia instead of labeling them as schizophrenic. It's a small change, but it can make a big difference in how we view and treat people with mental health conditions.
That's a powerful reminder. It's about seeing the person, not just the diagnosis. And speaking of diagnoses, this textbook goes into detail about dementia and delirium, which can be challenging to differentiate.
Right, and you've likely cared for patients with both.
Right.
The key difference, as the book highlights, lies in the onset.
Right?
Delirium comes on suddenly, often fluctuating picture. That post-operative confusion, some patients experience dementia on the other hand, is a gradual decline in cognitive function.
Okay, that distinction seems super important for nurses to grasp, especially when you're trying to figure out what's going on with a patient who's showing signs of confusion.
Absolutely, and the textbook mentions some assessment tools that can be helpful in differentiating between the two.
Right.
For dementia, the Mini-Cog and the MoCA are quick screens. They're good ones to have in your nursing toolkit.
And those acronyms are a good reminder that nursing school is all about learning a whole new language.
Right.
But seriously, having those quick assessment tools can be so helpful in those busy clinical settings.
Definitely. And for delirium, the confusion assessment method, or CAM, is the go-to. Remember, early detection is crucial for both conditions as it allows for timely intervention and support.
Okay, so we've talked about a lot of heavy stuff today. Brain anatomy, neurotransmitters, stigma, dementia, delirium. It's a lot to take in. But I think it highlights just how complex and fascinating the world of mental health is.
It truly is. And as nurses, you'll be dealing with these concepts throughout your careers. So it's great that you're diving deep into this now. The more you understand, the better prepared you'll be to care for your patients with compassion and expertise.
And this textbook reminds us that mental health disorders often occur together. What are the implications of that for nurses?
Oh, yeah.
It seems like it would add another layer of complexity to patient care.
You're right. It does. And that's why it's so important to have a strong foundation in mental health nursing. You need to be able to recognize the signs and symptoms of various disorders, understand how they might interact, and provide holistic care that addresses both the physical and emotional needs of your patients.
It sounds like a lot to juggle, but it's also incredibly rewarding to be able to make a positive impact on someone's mental health journey.
Absolutely. And remember, you don't have to do it all alone. There are so many resources available to nurses, including mental health specialists, social workers, and support groups.
That's good to know. Now let's dive into some of the specific disorders that nurses need to be aware of. This textbook has entire chapters dedicated to anxiety disorders, things like generalized anxiety disorder, social phobia, panic disorder, and PTSD.
Yeah, these are incredibly common conditions, and as you mentioned, they often go hand in hand with other mental health disorders. It's a complex web for sure.
So how can nurses best approach assessing for anxiety? It seems like patients might be hesitant to discuss their symptoms or might not even recognize them as anxiety.
You're right, it can be tricky, but as with anxiety, starting with open-ended questions is key. How have you been feeling? How has your mood been, Priver? These simple questions can open the door to a deeper conversation.
And if they're struggling to articulate their feelings, what then?
You can provide some prompts to help them get started. The textbook suggests asking something like, describe your mood lately using 3 words.
That's a great idea. It gives them a framework to start expressing themselves.
Exactly, and then listen carefully to their responses. Words like guilty, irritable, angry, or hopeless can be indicators of depression, even if they don't explicitly say sad.
It's like being a detective picking up on those subtle cues in their language.
Precisely, and it's important to remember that sadness after a loss is a normal part of grieving.
Right.
It might not necessarily indicate clinical depression, but if that low mood persists beyond a typical grieving period, or if it's accompanied by other symptoms, loss of interest, sleep changes, difficulty concentrating thoughts of suicide, then it's time to take it very seriously.
It's about looking at the whole picture, considering the context, and trusting your gut instinct if something feels off. It's also important to rule out any medical conditions that could be contributing to their symptoms, right?
Absolutely. Conditions like hypothyroidism, for instance, can mimic depression. So if a patient comes in with fatigue and low mood, it's important to investigate all possibilities.
That makes perfect sense. Now, memory problems are another common concern, especially as people age, and the textbook talks about dementia and delirium as being classified as neurocognitive disorders.
Yes, and the book emphasizes that getting information from family members or loved ones can be really helpful in assessing cognitive impairment. The patient themselves might not be fully aware of the extent of their memory problems.
That's such a good point. It's like we need to be detectives, gathering information from multiple sources to piece together the puzzle.
Exactly. And when you're talking to the patient, asking questions like, have you or anyone you know expressed concerns about your memory, can be a gentle way to open up the conversation.
It's about approaching the topic with sensitivity and respect, recognizing that it can be a scary and confusing experience for the patient and their loved ones.
Of course. And if they do acknowledge memory issues, the next step is to explore the timeline.
Okay.
When did they first notice the forgetfulness? Was it a gradual onset or did it happen suddenly?
A sudden onset could signal something like a stroke or a head injury, right? While a slow, gradual progression is more characteristic of Alzheimer's disease.
That's a good distinction to keep in mind, and if they're describing a gradual decline, it's crucial to inquire about any other accompanying symptoms.
Like, have they noticed any unusual movements they can't control?
Exactly. Those details can help you narrow down the possibilities. Hand tremors or difficulty initiating movements might suggest Parkinson's disease, while in a younger patient, unusual movements could raise concerns about Huntington's disease.
And what about changes in personality or how they interact with others?
Those are important clues as well. Personality changes could be a sign of frontotemporal dementia, while visual hallucinations might point to Lewy body dementia.
Wow. There's so much to consider, and the textbook really emphasizes the importance of assessing functional impairments, especially when it comes to safety.
Absolutely. Can they perform daily tasks like bathing, dressing, and eating independently? Can they manage their finances or navigate their surroundings safely? These are critical questions that can help determine the level of support the patient needs.
It's about looking beyond the diagnosis and understanding how the condition is impacting their daily lives.
Exactly. And remember, it's not always a clear-cut case of one specific disorder. The textbook also delves into the realm of medically unexplained symptoms, which account for a significant portion of office visits.
It's fascinating, isn't it? Sometimes patients present with persistent recurring symptoms that just don't seem to have a clear physical cause.
And this can be incredibly frustrating for both the patient and the healthcare provider.
The textbook highlights the importance of recognizing the interplay between physical symptoms, functional syndromes, and mental health conditions like anxiety and depression.
It's not always either or often there's an overlap, and that can make diagnosis and treatment more challenging.
For example, a patient might come in focused on their physical complaints, chronic pain, or fatigue, without realizing that underlying anxiety or depression is playing a role.
That's a great example. It underscores the importance of taking a holistic view of the patient and considering all potential factors.
It's about connecting the dots and recognizing that the mind and body are intricately intertwined. Speaking of connecting the dots, the textbook goes into detail about the physical examination and the key components of the mental status exam.
This is where your observational skills as nurses really come into play throughout your interactions with the patient. You're gathering information about their appearance, behavior, speech, mood, and thought processes.
It's like being a detective, carefully observing every detail and piecing together the clues to get a complete picture of their mental state.
Yeah, it really is like being a detective, isn't it? Just piecing together all those little clues.
Okay, so first up, we assess their appearance and behavior.
Right.
Is the patient alert and responsive?
Right. Or are they lethargic or even unresponsive?
And what about their posture and motor behavior? Are they relaxed, tense, restless, agitated?
Those are all important observations. And don't forget about their dress, grooming, and personal hygiene.
Right.
These can provide valuable insights as well.
It's about noticing those subtle cues that might indicate distress or changes in their usual behavior.
For instance, if a patient who's usually well-groomed suddenly appears disheveled and unkempt, it could be a sign that something is amiss.
Or if they're usually quite talkative but become withdrawn and quiet, that's another red flag.
Precisely. Next, pay close attention to their speech and language.
Okay.
Is their speech fluent and coherent, or is it hesitant, rambling, or even nonsensical?
The way they speak can reveal a lot about their thought processes and overall mental state.
For instance, rapid, pressured speech might suggest mania, while slow, hesitant speech could be a sign of depression.
It's amazing how much we can learn from simply observing and listening.
It really is, and it's important to listen not just to what they're saying, but also to how they're saying it.
Right.
Are there any abnormalities in their thought content, like delusions or hallucinations?
Delusions are those fixed false beliefs that they hold on to despite evidence to the contrary, right? And hallucinations involve perceiving something that isn't actually there.
You got it. For example, a patient might insist that they're being followed by government agents or that they're hearing voices.
Those are classic examples, and it's crucial to approach these conversations with sensitivity and empathy.
Yeah.
We don't want to dismiss their experiences, but we also need to try to understand their perspective.
Exactly. And then there's mood, which is another critical component of the mental status exam. Is their mood appropriate to the situation, or does it seem incongruent or exaggerated?
For instance, if a patient is laughing hysterically while discussing a tragic event, that could be a sign of a mood disorder.
That's a good example. It's all about looking for those discrepancies between their expressed emotions and the context of the situation.
And the textbook stresses the importance of asking directly about suicide risk, especially if you notice signs of depression or hopelessness.
You're right. It's a difficult conversation to have, but it's absolutely essential. Asking directly about suicidal thoughts doesn't increase the risk of suicide.
Yeah.
In fact, it might be the only way to uncover those thoughts and intervene effectively. It could literally save a life.
Okay, now let's move on to the cognitive aspects of the mental status exam, which the textbook breaks down into orientation, attention, memory, and higher cognitive functions. It's like we're giving their brains a little workout.
It is a bit like that. Orientation is all about assessing their awareness of person, place, and time. You can ask simple questions like, can you tell me your name? Do you know where you are? What day is it today?
And if they're disoriented, it could be a sign of delirium or dementia.
That's right. Then we have attention, which is all about their ability to focus and concentrate. You can test this by asking them to repeat a string of digits forward and backward, or to perform serial subtractions.
And memory testing involves both short-term and long-term memory, right? Mm-hmm. You can ask them to recall a list of words after a short delay, or to inquire about events from their past.
Exactly. And higher cognitive functions encompass things like abstract thinking, calculating ability, and constructional ability. You could ask them to interpret proverbs, solve simple math problems, or copy geometric shapes.
So basically, we're getting a sense of how well their brains are firing on all cylinders.
That's a great way to put it. And remember, thorough documentation is key.
Right?
Clearly describe the patient's appearance, behavior, speech, mood, thought, content, and cognitive function.
This documentation not only helps to track their progress, but also allows other healthcare providers to get a clear picture of their mental state.
Now, this has been a lot of information, but I think you'll agree this textbook has really given us a solid overview of the brain and mental health.
It really has, and I think it highlights just how vital this knowledge is for nurses.
It is. We're going to be encountering these concepts every single day in our practice.
So it's not just about passing an exam, it's about really understanding these concepts and applying them to real-world patient care.
Exactly. And I think this deep dive has given us a great foundation to build upon.
I agree. And it's just the beginning. We're going to keep learning and growing throughout our careers.
Absolutely. The brain is so complex, and there's always more to discover.
And as nurses, we have the privilege of being part of that journey of discovery.
It's pretty amazing when you think about it.
Well, I think we've given our listeners plenty to ponder.
I think so.
And hopefully inspired them to continue their own learning journey.
Me too. It's been a pleasure diving deep with you.
Likewise. And a huge thank you to our listeners for joining us on this deep dive into the world of the brain and mental health. We hope you found it informative and inspiring.